Into engaziwa ngama-South Africans ukuthi ma into le ibanjwa i-exposwa kanjena, thina it's a victory as Zimbabweans. We are celebrating because there are number of lives that has been saved ngokuthi into le ingaphumeleli ukufika eZimbabwe.
Absolutely cruel for South African government officials to kind of give lip service about apologizing for the deaths, only for them to actually use that platform to spend 80% of the time talking about the stolen medication. But the story of the stolen medication doesn't make sense. It doesn't make sense because Malawi and Zimbabwe both have bigger, better HIV treatment rollout programs.
Hello and welcome to the channel. Let's take a look at the minister in the presidency coming out and slamming Zimbabweans for allegedly smuggling medication, something that Operation Dudula raised. However, people from Zimbabwe and other nationals in South Africa have already said that no, those were not ARVs. However, whether it was ARVs or whether it was from public facilities, it proved Dudula right that there is a smuggling of medication between borders illegally because they did not have the right authorization and permits to do so tricky a little bit. We saw that Zimbabwe has come out to say that they will be supporting the families that have lost their loved ones. That was a surprise, and big ups to them. The ambassador of Zimbabwe was also seen in the area in Limpopo where the horrible crash scene occurred. So at this moment, let's take a look at the sentiments around this bus incident, but also the issues that came out of it after that. Take a look at this. Please give this video a thumbs up as we do that.
This message from the Presidency of South Africa that mirrors the message of Popira Matuba, who is very anti-Zimbabwean as the MEC of Limpopo, is shoddy, terrible communications, and real bad diplomacy. The reason this message is pathetic is because it actually amplifies and it exacerbates the anti-African xenophobia and anti-Zimbabwean sentiment that Cyril Ramaphosa purports not to want. There is absolutely no reason for Popira Matuba as an MEC of Limpopo and the South African presidency to say anything about what they found on the accident scene, because the people of South Africa have no power. That is why they're still under colonialism. That is why the ANC is going to lose elections next year to the DA, because they don't have power to control communication, what people think, or what is put into people's minds. But this message was deliberately put into people's minds by the MEC of Limpopo and the presidency of South Africa to perpetuate hatred of Zimbabweans in particular. Why do I say that? The bus was going to Malawi via Zimbabwe. It had Malawians and Zimbabweans on the bus. But the communication that is prevailing from the MEC of Limpopo and also the media of South Africa is the bus was going to Zimbabwe. And then they tell us that they found ARVs on the bus, but they keep showing us pictures of the Bronclear, which is bought directly from Adcock Ingram and not stolen from hospitals, but they do not show us the ARVs that were stolen from the hospitals. But the story of the stolen medication doesn't make sense. It doesn't make sense because Malawi and Zimbabwe both have bigger, better HIV treatment rollout programs. Many people have always thought that I lie when I say that Zimbabwe treats HIV better than South Africa. And so within these discussions that we have on social media, some South Africans have decided to ask AI, in this case, Grok. And they asked Grok to give information on whether Zimbabwe has a better treatment program than South Africa or not. And this is what Grok said. Grok said Zimbabwe has less HIV prevalence at 11 to 12%, while South Africa has one at 17 to 19%. Zimbabwe has reduced HIV infections way much more than South Africa, while South Africa has actually increased HIV infections. Malawi is not too different from Zimbabwe, as they also reduced HIV by over 40%. I say to the ANC, There are better ways to try and stay in power, like taking land and giving it to your people, empowering your people and stopping the domination of apartheid-era figures in your economy, rather than trying to start violence, start a war, so that you can call for a state of emergency.
I was at Bridge, the Zimbabwean side, for quite some days. And I happened to visit the hospital, the Bridge District Hospital. I have got dates. I have got the evidence. I have got the stamps. I did accompany somebody who was not feeling well in the late hours of around 9 p.m. to 10 p.m. When we went to the hospital, the nurse wrote a certain prescription and handed over me the paper. And I said, what am I supposed to do here? The nurse said, you need to go and purchase the items mentioned on such a prescription. I said, where can I go and buy them? He said, around here, there are a lot of pharmacies that are still opened. For sure, a few meters away, I went to the pharmacy. I purchased those items at a cost of $13. I came back. When I opened the package, there were some items that I recall. There was a pipe for a drip and 2 connectors for that drip, the other one which connects the drip and the other one that connects to the human body. There was also a needle, 2 needles for testing sugar diabetes, if you are to be tested sugar diabetes. Some, they know the health jargons which they use. I fed the acid a lot of people whom were at the hospital. Then they told me that here, if you are admitted, you pay $6 for the bed per day, $6. For scanning, you pay $20. When our women are giving birth at such a hospital, they pay for jik and domestos, believed that they've spoiled the sheets and such sheets needs to be washed. Therefore, today I ask the Minister of Health, I ask the Ministry of Health, I ask the so-called activists, I ask the so-called oppositional political party leaders, and those that are in the ruling part of ZANU-PF, are you aware of that? Why is it that our people are suffering to such an extent? Imagine if such a person have got an infectious disease and does not have the money to pay for medication and for the bed at a public hospital. Obviously, this person is going to die at home. I think this is the main reason some of our people are crossing the crocodile-infested river of Limpopo right straight to the South African side for health or a medical attention. At border Bridge, we've got a port of entry that is generating a lot of money per day. We pay the health levy in everything that we purchase in Zimbabwe. There is health levy. Nearby the Bridge, just a few kilometers away, there is a toll gate, which means there is no shortage of money in Bridge. Again, we have got a pipeline that passes through Bridge to the South African side where we sell water to South Africa. All those economical activities and the mining activities surrounding such an area are failing to benefit and cater for our people. Is this Zimbabwe that is always said, Nyika inovakwa nevene vayo? I don't want to mention your names. I know you are so loud. I'm not talking about the negative side of Zimbabwe. I'm talking of reality. Where things are done in a rightful way, I do appreciate and applaud. But we are talking of a basic need of the people. We are talking of the health of the people, which should be free. Why are we bleeding our people?
If it is true that the medication was found on the bus, I want to say that my leaders and people who are part and parcel of my TikTok, my social media platform, the organization, and people who support and follow me. The issue of medication going to Zimbabwe did not start today. For many years, this has been happening. That's being honest. People gathering medication in South Africa by either through any door that they were doing. For instance, like myself, I'm going to send tablets to my father who is sick. I bought them in the famous today. Let me show you. I don't know where I put it. I want to show you something that I bought these tablets for my father. They are for arthritis. I bought them in the pharmacy. I've got receipts, and there might be people who are also buying tablets. Maybe they buy them in bulk, or they buy them in small quantities, or maybe they're doing wrong ways to get the medication. But the bottom line is saying, why is it that Zimbabweans are taking medicines from South Africa to Zimbabwe? That's what I want to put my own opinion and my views. Right, it's a sign that in Zimbabwe there is a lack of medication access to people. It means that they need help. You see, so myself as a leader, I see what happened as an advantage to start finding solutions. The people who are say they died in the bus, condolence to them, and may their souls rest in peace. But how do we avoid people traveling from South Africa to Zimbabwe and die looking for life? The only solution is for us to go to Zimbabwe and stay in our country so that we build our own country. I know some people, they are saying umnangagwa wafoira kana kuti umnangagwa president ufailile. He is not failing. We are actually failing together. Because the moment you speak the failure of your father, you are also showing that you are a failure by not assisting your leaders to do what is right for them and for yourself.
By the way, you know, the moment we engage a match ekuthanisha image yomunye umuntu, something bad also is happening on your side. Instead for you guys ukuthi manje lithi join hands ukuthi let us destroy into lesingayifuni kuma township ethu, singayifuni kuma communities ethu. You want to push propaganda ukuthi these are ARVs, but ingane zenu ziyayazi ukuthi into le akusona iARV and ziyayiconsume and ziyafa. No wonder why there are so many lokuzeni nyawupezi in South Africa. It's just because of your ignorance as adults. Because you tell ukuthi ama drugs are being sold ngama Nigerians, yet they consume such kind of these substances. And just because we want to nationalize the crime, sithi ama Nigeria aseqeda ingane zethu badayisela drug, kanti ingane zenu ziyazi ukuthi no, asiyo yonke into ebhenywayo, akusiyo yonke ibhekayo, akhona ama substances esingawaphuza and bawaphuza bayalimala, future yabo iyaphela. Just because of your ignorance, you focus entweni ezingelancedo.
Well, there you have it. Those are some of the views and sentiments coming in there. Please go out and follow the different pages on social media platforms. As you have seen, that Minister Ntshavheni from the presidency was not sparing or mincing her words and calling out any of the foreign nationals that are involved in smuggling a medication, whether it is from public sources or private sources. However, there are channels and permits that are required to do so, but mostly highlighting the risk that comes with that, because there are certain prescriptions and storage conditions that are required for medication to be effective. But also, if it is indeed ARVs, if they are not taken consistently and they are taken in dribs and drabs or not in the prescribed dosages rather, it could cause a lot of patients to be then ARV resistant. Since we are talking about medication, guys, let's take care of our health and our bodies. Our future selves will thank us for the things that we are sacrificing today. But it doesn't mean now, okay, people must steal medication. As Minister Ntshavheni has said, let's use the right routes. Let's lobby our governments, yes, Zimbabwean government, to then look for funding to get the right type of treatment for the people of Zimbabwe. When it comes to Rutendo, you can expect anything. But what he raised, what are your thoughts on this? Let me know what your sentiments are down below. Please give this video a thumbs up and I will see you on the next video.